First of all, welcome to everybody that's able to join the call, and appreciate you making the time to be with us today. Hopefully we'll get a few more trickle in as we go. But yeah, if we want to jump right into our presentation, and I think we've got a little, maybe some questions that we've sort of sent to our three guests today to help us understand how Pillsbury House works and some of the challenges and opportunities there, and maybe we'll have a little time for questions and input and such afterwards. So our three guests are all at Northwestern in some capacity. Jodell Skaufel is with the chiropractic program and serves as is a faculty member and a supervisor of chiropractic interns at Pillsbury House United Healthcare Clinic, and has been for several years. I think one of our longer serving supervisors out there. I'll let her talk about that. Nancy Erickson is our massage therapy faculty member and supervisor out at Pillsbury House. And then Ellie Tansey is representing acupuncture and Chinese medicine, both a supervisor at Pillsbury House and at a couple of other sites. Actually, most recently, she's supervising students in the hospital setting over at Regent's Hospital in St. Paul for us. So without further ado, I will turn it over to these three individuals. And I think Beth, maybe you can remind me of our format on this. I think we had a few questions on the next slide that these folks were going to address for us, and then Q&A after that. Is that
That's
close?
How we've done it in the past. For this one, we just made it very general. So the questions are, how does Pillsbury House work? Or what challenges have you faced? I think Jodell, Nancy, Ellie might have questions themselves that you'd
Sure.
like to get feedback from the group, and then the group will have questions. So I think it's primarily going to be general overview from our guests, and then an exchange of questions from both sides.
Perfect. So maybe I can set this up just a tiny bit, because Pillsbury House, just as a reminder for those of you who may not be familiar with Pillsbury House, and our supervisors, guests will go into this maybe a little bit further, but Pillsbury House United Communities is a social service organization that provides a variety of services to the underserved throughout the Twin Cities area of Minneapolis and St. Paul. There are multiple locations. We operate the Pillsbury House Clinic out of their main location in South Minneapolis. For the past 10 years, as a matter of fact, we're having a celebration and fundraiser this fall celebrating the 10-year anniversary of Pillsbury House Clinic being open. So that's kind of exciting for us. But for the past 10 years, we've provided acupuncture, chiropractic, and massage therapy services, as well as in partnership with some other institutions that we work with, medical care and consultation. We've had nurses in there. We've got counseling as part of the services being offered over there. And over the years, we've had various versions of the policies and procedures, trying to get to that elusive integration of care that we're all striving for. So maybe with that, I'll turn it over to these three individuals finally, and let them tell us a little bit more about how Pillsbury works, some challenges, and yeah, as Beth mentioned, the idea of this is not to present, to sweep the challenges under the rug, rather to lay those bare for the group to hear about and see and offer their input about possible solutions. So I don't know who wants to jump in first. Jody, if you're there, maybe.
Okay. Well, thank you, Beth, for inviting us. And my name is Jodell Skaufel. As Dale had mentioned, I'm a chiropractor, and I started probably 6 months after Pillsbury House opened, so 9.5 years I've been there, and I've worked with Nancy and Ellie, and I can tell you it's been a great trifecta. But how Pillsbury House works, Nancy and Ellie, if you want to chime in at any time, superficially, Dale mentioned the schools that are involved. We have chiropractors, massage therapists, and acupuncturists from one school. From the University of Minnesota, we have health coaches, and then from Adler Institute, we have counselors. We also have student volunteers. They're medical students from the University of Minnesota. And then we do have some field medical doctors who practice holistic medicine who come in and help supervise. Generically, I'm not really sure where to talk about or how to talk about how Pillsbury House works, but when a patient comes into Pillsbury House, we have a united meeting. We try to bring in a representative from each of the disciplines, a student from each of the disciplines, and collectively we interview the patient. We call that initial interview and intake, and we take a comprehensive history. During that time, we want to make sure that we integrate the patient's goals for care and their preferences for care. Not everybody wants to be adjusted, for example, or wants needles, so we take that into consideration. After we collectively listen to the patient, we develop a referral system indicating which disciplines we think that patient would best respond to, at least initially, again, taking into consideration patient preference. And from there, the patient goes into the different disciplines. Each discipline may vary a little bit in how it delivers care. Of course, as a patient comes in, they're always going through yet another specific history and exam related to that discipline. But throughout the process, the goal is that we're all talking among each other, keeping each other informed as to how the patient is doing, what's going on with the patient, if any changes that need to be made, if there's any new issues coming up. Ellie or Nancy, do you want to respond to any of that?
Sure. Can you hear me?
Yes.
Yep, we can hear you. Thanks.
Am I way too loud? Because sometimes my computer does that.
No, you're fine.
Okay. Well, I haven't been at Pillsbury House since, I guess, June. I took a full-time job at the hospital, so I haven't been there this term. So I'm not, I guess, to speak to some of the challenges is where I would be most beneficial, I think. And I think, we have this great intention of bringing everyone in and integrating, and between the supervisors, we really do that for the patients. But oftentimes what doesn't happen is that the students kind of miss that thread being woven between us, and because it's such a fast-paced clinic, really with a large variety of populations, and sometimes we don't have the right interpreter for the right language, so some of those things can be challenging. I apologize because I'm not sure exactly what information you guys are hoping to get. Does anyone have a specific question, or?
This is Beth, and I don't know if this is helpful, but is this, just to put this up on the screen so people can see this and know that there's a website to go to, is this website still accurate? I mean, is this where you would send people?
Yes.
Okay.
That's the current website for Pillsbury House. And one of the things that I know that we've had problems with interpreters in the past. This new trimester, we've brought on a whole group of new medical students from the University of Minnesota, and they're bringing a whole new energy to the clinic, which is really exciting. They're really eager to learn about all of the different disciplines, and it's kind of fun because they're in their first year, and so they're really fresh and new, and it's fun to be able to introduce all of the different disciplines. And then we've also been able to secure some work study funds for one of the chiropractic students who can come in and serve as a Spanish interpreter. So we've had, it's kind of an ongoing issue with having a consistent interpreter, but so far so good for this trimester. So that was kind of exciting to have those developments that just happened a couple of weeks ago in September. So,
oh, that's great.
yeah.
I kind of take a slight variation, and I guess globally look at some of the challenges. And, you know, one of the challenges I think faces all of us, that faces everybody there, is a lack of knowledge of what the other professions do. Students, and it could be, even though we're at the same school, the chiropractic students may not really fully understand how an acupuncturist can treat something. So not even understanding what they can do, the scope of practice, how each of us are educated. Sometimes people think, and I'm just referring to chiro, but people will come up and go, oh, you're a chiropractor. Oh, so 8 months of education, huh? So they don't know, again, the education or the scope. And I can play into some of the roles of who takes over the power or control over some of the meetings that we have, who should be in charge. And so trying to work as a collective and trying not to just ignore, for example, well, massage therapists, well, they only have so much education, they shouldn't really know a whole lot, so we need to overpower them as chiros because we have so much education and downplay what their significance is. Sometimes I see that happen, at least within the chiropractic interns. Ellie, and again, Nancy, if you have anything to say to that, that would be helpful. But I think another issue is sometimes we get the groups to be too large. We found that we would have these meetings where we bring in 15, 20 students to talk about a situation, and the learning, I think, the learning didn't quite happen like we wanted it to. People would come out and say, oh, that was a great experience, and if I asked them, well, what skill did you learn? They would maybe smile and go, it was a great experience. So really wanting for the future to set seeds in how teaching students how to actually collaborate. And with collaboration, it's not just understanding the roles and responsibilities, scopes of practice, et cetera, of each other, but it's also understanding how to work together as a team. And that team includes communication skills, learning how to respect each other, and how to address problems in a very tactful way.
Jody or others, this is Dale, ask a question here on that note. How much of that happens on an informal, non-structured way, just by everybody being in the same space? Do you find that the chiropractors and the acupuncturists will, express some curiosity about, what are you doing there, and tell me about that, or massage therapists are interested in what the chiropractors are doing? Is there an informal sort of natural connection that happens among the interns that's of value, or is it do folks tend to stay in their pods or whatever, their little areas, and not reach out? And how much value is there to that element of it?
I think that people do, at least in my experience, people have tended to stay in their own pods, and occasionally when there's time, branch out into other pods. And we've really worked this to try to see how can we get the students more integrated so that they're all kind of working and learning what each discipline is doing with a particular patient. But I think that just the nature of Pillsbury is that it's so busy that often doesn't happen as often as we'd like it to.
Sure.
Well, and we have a new, oh, you have to cut out now, Jody?
Yes, I do need to cut out. Thank you, though, for giving me the opportunity to speak and to bringing this to the surface and letting us talk to others about our clinic.
Thank you so much for
Thanks,
being
Jody.
on, Jodell.
Thanks, Dr. Skaufel.
Hi, Jody.
Bye-bye.
Yeah, so we just had a new clinic manager come on board in the last couple of trimesters, and she is really wanting to champion the whole getting the students to talk and integrating a little bit more. So just, we've only been open a couple of weeks after the summer break, and like last night we were able to actually get 2 of the new medical students on a massage table. They'd never had a massage before. So we were able to have students interacting like literally hands-on and they could ask questions back and forth.
Oh, it's great.
And then I had one of my interns who was able to go get an acupuncture treatment for the first time. So I think it's going to be more kind of just as things are available, we can kind of sneak that in a little bit more. But the nature of the clinic, as Ellie said, it's just so busy and so fast-paced. It's really hard to get them out of their pods unless we have like, oh, we have an opening. Let's be more intentional about getting them together and talking.
Maybe you could talk just a little bit about the role of the medical students in that environment. I know that's something we've kind of struggled with a little bit in the past, and as to what services they provide, if any, or how they interact. That's a good example of them, getting a massage, which is fantastic. Can you talk a little more about what the medical students do when they're at the clinic?
Sure, and that is still an ongoing issue. We don't really have consistent supervisors there for the students. So we do now have a couple of second-year medical students who are able to come in and kind of not really supervise, but manage what they're doing a little bit more with the first years. Ellie, do you want to hop in and say anything about that?
Yeah, I mean, I hesitated because I know you guys are switching things up a little, but in the past, their role has really been quite minimal. They've been doing some intakes because most of our students are upper tri-levels in terms of the students from Northwestern, so they're already pretty good at doing intakes. So the medical students will often lead the integrative intake. They'll often do basic vitals on patients as they come in. So, blood pressure, heart rate, that kind of thing, look for red flags. But because they haven't had consistent supervision, we've had to be sort of minimal. So we kind of try to integrate them more into pairing them up with our disciplines so they can learn more about what we're doing.
Mm-hmm. Yeah, and it's still similar to that. We are trying to implement like more before people get their first treatment of the night or the morning, having them have their vitals done and having a check-in with the medical students just to see how are their treatments going, is there anything that's helping or not helping, do we need to change their treatment plan, that sort of thing. We're trying to get them to take more of a leadership role in that aspect. Mm-hmm. And also, like last week I had somebody with a potential Baker's cyst. So I had the medical student come and, look at it and see what she thought. And she was just so excited that she got to look at a Baker's cyst. So it's, something silly, but, when you're a new student, you're going, yes, I get to see what a Baker's cyst feels like. So,
yeah.
Like if there's a cut on somebody's foot or something, we might have them look at that. So, again, it's being more intentional of trying to include them. And we have some really eager new students, and I think they're going to be able to come up with ideas as to what else they could be doing to help us other than just doing the vitals. That's
great. Maybe you could talk just a little bit about the patient population that you see at Pillsbury House, given the setting that it's in and that it's free care and the types of conditions and such that folks come in with. And then as a follow-up question to that, I'm interested in, I think the group might be interested in, I have some knowledge of it, I guess, but obviously in a clinic where you're providing free care, there may be you may be unable to meet the demand of the folks that are coming through the door, and maybe you could talk a little bit about how the challenges that's presented for us as we're trying to create organized treatment plans around, come in every 2 weeks. How do you do that with such limited hours and free care? So patient population, and then the impossibility, I guess, of meeting the demand for this sort of thing.
Well, the interesting thing about Pillsbury House is that it's in one of the most socioeconomic and culturally diverse neighborhoods in the state, if not the country, from my understanding. So you really get folks from all walks of life. You know, here in Minnesota, we have a large Somalian population, a large Hispanic population. So, you know, those are where we need more interpreters, because a lot of times those folks come in and they don't have a lot of resources. And, you know, or just anybody from the neighborhood maybe doesn't have enough resources, and they'll a lot of times come in and they don't understand that we're not a primary clinic. So they'll have expectations that we can't meet that way. But, you know, we've got people who drive in 2 hours from, you know, southern suburbs because they appreciate the work we do, and maybe they've got, you know, financial hardship, so they're not able to get their needs met through their insurance, or, you know, maybe they're not insured. Is that sort of what you're speaking to, Dale?
Yeah, that's perfect. Just trying to get a sense of, you know, who takes advantage of this care, and then the conditions. You know, do we see conditions in this clinic because of the population that we're serving and the fee structure that we might not see in Bloomington in the, you know, fee-for-service clinic?
I think we do, because we get a lot of people in there who have chronic pain and have been dealing with it for a long time, and that chronic pain could have come from, you know, any number of different places, and, you know, in terms of what people have experienced in their life. It could have been something very traumatic, could have been something really simple as throwing your back out. But the patients who come there tend to stick around for a long time, and I think the students do get to see people who are more chronically ill, whereas in some of the other clinics, which I don't know if I'm the best person to speak to that because I don't work in them as much, it's more of a voluntary, you know, people maybe want to come in for wellness visits, or, you know, just because it feels good. Nancy, can you speak to that?
Yeah, and I would think that because of the population that we're serving, a lot of them are a lot of more manual labor. So when the students are on campus in the student clinic, people are typically pretty healthy that they're working on, and then when they go to Pillsbury House, their eyes are just wide open. You know, they're seeing body types that they've never worked on before. You know, like you said, it's more chronic and just like really tight. Or we have a couple of people who might have brain injuries. We have somebody with Ehlers-Danlos, and students are like, I've never even heard of that. Now I have to work on them. So I think we are seeing different things coming through the door than they would see here on campus, and they just get so excited about it. You know, it just empowers them to kind of grow their hands-on, their communication skills, you know, being leaders and determining what their treatment plans should be. So I know the students love the diversity of the population that they're working with.
Absolutely.
And just learning how do you work with an interpreter, you know. We also have quite a few like transgender clients, so they're learning, you know, how do you even talk to somebody who's transgender, and what kind of special physical things come from being on hormone therapies, and it's a great learning experience from them in that aspect.
Absolutely.
And I think as far as not being able to treat them as often as we may want to, or if they have a condition that they need, you know, more medical attention, we have other clinics in the Minneapolis area that we can refer them to. That would be either sliding fee or a free for service. So we do that quite often.
Would this be a good time to, we have a question, MK had a question in the chat, so would this be a good time to?
So MK's question, I don't know if everybody can see that, are there opportunities for multidisciplinary rounds to discuss patients with chronic issues? So I think this is about, you know, is there time set aside or a specific opportunity to, as a group across disciplines, to visit about a complex case? My understanding is we're bringing some of that back just right now. So Nancy, Ellie may not be aware of that piece, but well, either of you. But I think Nancy may be more aware of efforts in that regard to create opportunities for discussion of complex cases.
Oh yeah, sorry. We are going to be re-implementing some of those meetings where after a client has been seen, for a few months, and we need to do a re-evaluation. Is it working? Are we helping them? Do we need to approach it differently? So those are called re-evals. We're going to be implementing those hopefully by the middle of this trimester, just kind of going over some of the clients who've been there for a long time and looking at, have they had any health condition changes? Should we be sending them to the health coaches to help them with certain aspects? And then also at the very end of the shift, we're going to have the students come all together into what we call the dance studio and stand in a circle and discuss any new patients, or if anything new has popped up that might be interesting or might need some discussion, we're going to start doing that. And that's just like a quick, maybe 10-minute meeting at the end of the shift.
Oh, that's great. Yeah, I think there's so much to learn. Oh, I'm sorry.
Nope, you go ahead, Ellie.
No, I was just going to say there is so much to learn from those rounds, and I think in the past we've just had trouble with time, and it's because different disciplines are there, have different schedules, and so we used to kind of meet and pick a case each night and kind of discuss it as a group of, anywhere from 20 to 30 people. So I'm glad to hear that's coming back.
Mm-hmm.
Other questions from the group about Pillsbury House, how it works, or?
I was just wondering if there's anybody else out there who is involved in a similar clinic, and like you said, Ellie, any suggestions on how to find time for more integration?
And while folks are thinking about that and maybe want to chime in at any time with that, we also have Diane asked a question just now on the chat. How are you funded? Who pays
Dale,
the bill?
you want to speak to that?
Sure. So we have we budget. Most of it is budgeted just as a line item in Northwestern's budget. We have received a few small grants over the years to take the edge, that help take the edge off. I know Pillsbury House itself had a grant that helped helped offset the expense on their end of the space, so that they didn't feel the need to charge us rent. They got a grant, I think, through the United Way that paid for rent of the space, and my understanding is that was not renewed, or we're looking into it now. So that may cause us to seek other sources of funding or tighten our belts just a little bit. But the majority of, the supervisors and those sorts of things, supervisor expenses, we just treat it as a clinic, basically, that students are trained in, but obviously there's no income. So, and then one other question I see here: are supervisors at Pillsbury House employees of the clinic or funded by the participating colleges? They are funded by the participating colleges, so we don't pay for the medical. When there's MDs that come and supervise, or there's folks from the Adler Institute. Those are all, to be honest with you, I'm not exactly sure how they're funded. I assume similar to us, just as a line item. EHR, we don't use an EHR at Pillsbury House anyway. There is on campus here, but it's all paper at this point at Pillsbury House. We have a vision of incorporating our GE centricity system into Pillsbury House and other off-site clinics, but right now it's paper. Are you tracking any outcome measures? We are not. That's another one that, with being an all-paper system, obviously that makes it a little more challenging. But I would say the tracking of patient outcomes, as well as just documentation in general, is is an area for improvement, an opportunity for improvement at Pillsbury House. I don't know, Nancy or Ellie would agree with that, or?
No, I would agree with that, but I would just like to say I think those re-evals are sort of our way of tracking outcome measures, even though it's pretty, basic.
Well, and it would be written in their file on a piece of paper, so there's no way we can pull any reports.
Right. So on an individual basis, yeah, we are, but not on a gathering, assembling data about how effective our approach is. And somebody's lost connection. They're troubleshooting it, but may have to sign off. I think that's Nicole. So let's see. So Nancy had a question about what's that?
Oh, Diane had a question about could tracking and reporting outcomes open up opportunities for funding?
Absolutely, for sure. That's that's going to strengthen our case for grants and funding if we're able to show that we're actually making a difference here through patient outcomes. So certainly something that's on the list, but has not as yet become a reality.
And I know that next week they're actually going to be filming. They're going to be interviewing some of the students, the supervisors, and patients. So I think that's one of the fundraising efforts that they're working on right now.
I think that's right.
I found that out last night. So yeah.
So Nancy had a question to the group about others that are involved in similar clinics or might have general feedback or input for Pillsbury House. Anybody think of anything while we were answering those other questions?
This is Marcia. It's not exactly parallel, but we do run an integrative clinic here at the University of Bridgeport in which and I know it's been a couple of years now, I think, that we've talked about it, but there's a chiropractic student and supervisor, or a couple of chiropractic students and supervisor, naturopathic students, acupuncture students, and dental hygiene students. And a patient comes in and sees each of those disciplines individually for a brief time in one morning. And then the group gets together and talks about what the best approach is for that patient in terms of what their issues are and where to start. So they decide which discipline would be the best to start with.
So would that be is that on their very first visit to the clinic then?
Well, the first visit, the patient doesn't get told because the patient's discharged from the appointment at the end of the series of interviews. And then the group gets together and then someone contacts the patient and communicates that and sets up an appointment. We do use a shared EMR, so that information goes into that. I'm not terribly involved with that, so I can't give you a lot of details, but it is something that we have had in place for several years. So no treatment is recommended with that first visit. No assessments are recommended with that first visit because we don't know who it's going to be, who the patient will end up with, what discipline. And then, which is, sometimes that's an issue because, well, we would know better if, in fact, they have this condition or that condition if we ran this lab. Well, but we don't want to run a lab if we're not going to be the person to follow up with them. So that gets, there are, things that are always a challenge, but that's how it's been run, and worked pretty successfully.
So are you open several days a week, or this
is one day a week that they run this clinic.
Them?
Yeah, they run this particular integrative clinic just one day a week. We're open 6 days a week so that when the patient comes back, they're not restricted to that one day. But if they want to be part of that, and they're not charged for that initial visit. When they come back for treatment, there are minimal charges that are put in place. So it's not a free clinic, but it's a pretty reduced cost. But that first visit when they're just interviewed, there is no charge for that.
Okay, great. Thank you.
Mm-hmm.
We've got one more question.
This is Martin Kidwell speaking. Can you hear me okay?
Yep. Go ahead, Martin.
Okay. Yeah, I just wanted to chime in on this one. This is something that, you know, at OCOM we are looking to develop as we, you know, are developing our own professional doctorate program, entry-level doctorate, because these kinds of experiences are obviously, you know, essential for the standards of the doctorate, but also, you know, obviously also for master's students as well. We did have a situation back a number of years ago with a partnership with OHSU at their Richmond clinic, and this was before I came here. And as I understood it, it was essentially the setup was that, you know, our supervisor and interns would see the patients with the physician on staff there, and they would be doing, you know, their respective intakes and exams together. And then the treatment plans for both the, you know, biomedical treatments and the Chinese medicine treatment, they'd come up with that and administer that. So there was a simultaneous treatment process that was developed and instituted there at Richmond Clinic. Fortunately, and you know, I think it was there are a variety of reasons why, but that didn't persist. It went for a couple of years, and they brought some other people in, decided that that was not efficient enough. But really, I think these kinds of situations, you know, there has to be a commitment to this. Because they're not going to be as efficient as a you know, single a discipline going through the interview and exam process. But if we're looking to educate people in integrative practice, there has to be a commitment to bringing the groups together in the clinic. So that's just an example of the way I know we did things at one point at OCOM, and I am looking to try and you know, recreate that with some of the partners that we're developing clinical opportunities with right now.
That's great. That's good. Thank you.
Mm-hmm.
One question in the chat box there. Do you collaborate with other healthcare clinics? And a question about referral source. So who's referring folks to Pillsbury House, I imagine that is, and who else do we collaborate with? I think that was referenced earlier on in the conversation. Ellie or Nancy, do you want to comment on that one?
Well, as far as collaborating, we don't really share medical records with other clinics, but we do refer back and forth. We have another Northwestern clinic through Salvation Army, Harbor Lights. So we have chiropractic and acupuncture available at that clinic. And then there's a couple of just like neighborhood clinics, the Phillips Neighborhood Clinic, and then also the University of Minnesota has a clinic that they can see people. So we often send people to different clinics, and they send them back to us as well. But as far as collaborating with them for care, we don't necessarily do that.
Yeah, and the patients themselves are our primary source of referral, because they generally have a positive experience at the clinic and will, you know, kind of tell everybody, and then we're a little bit overwhelmed with more than we can handle just being open for such a short amount of time during the week.
All right. Well, thank you again so much, Nancy and Ellie. I think in the interest of time here, even with John being off the agenda, I know we're getting a little bit short on time here. So if there's no other burning questions one way or the other, I think maybe we'll wrap this piece of the agenda up and move on. So we didn't invite both of you, of course, to stay on for the rest of the call. But again, I'd like to thank you for being here and presenting that information today.
Yes.
Thank you for having us.
Thank you.
Thank you, and echo what Dale said. You're welcome to stay on the call, see what comes next, and we really appreciate your time. And Dale, thanks for a great job facilitating as well.